Hello everyone, I am Dr. Avinash Chaitanya. I am a head and neck surgical oncologist at Care Hospitals, Hyderabad. Today I am going to talk to you about recurrences in oral cancer. So as you know, oral cancer is very notorious in having a recurrence, that is the tumor coming back after completely being treated. So there are various ways in which the tumor comes back, and when the tumor comes back, the place where the tumor is at present is going to determine what treatment we are going to do. So the first and the most common thing is a local recurrence. Generally it occurs because of field changes. That is, the most common cause of oral cancers being tobacco in its chewing or smoking form. There is a high chance of the surrounding tissue in the oral cavity to be developing precancerous lesions, which may at any time progress to form cancers. So if they occur within 6 months, you cannot differentiate whether it is a second primary or it is a local recurrence unless the site is totally different as compared to the previous one. The next most common recurrence is a nodal recurrence. In general, for oral cancer, we do the excision of the primary site with neck dissection of the ipsilateral side, that is the same side. But sometimes tumors which are aggressive, they tend to spread to the opposite side neck also. And if it is just a nodal recurrence that is determined on your PET scan, then we shall do a neck dissection and irradiate that side of the neck also. And also these are the treatable recurrences. What can happen when the tumor has spread somewhere else? That is, it is not in the oral cavity, not in the neck, but it is spread to some other part of the body. It is called as distant metastasis. The most common distant metastasis is lung. From the oral cavity, especially when the patient is having bulky nodal metastasis, it is very likely to have a lung metastasis. After lung goes the systemic, which can be either bone metastasis, liver metastasis, or sometimes even a nodule in the skin, like a skin nodule, can also be called as a distant metastasis because it means there is a subdermal spread of the tumor and we cannot keep catching it. So in that situation, we only offer chemotherapy as a palliative treatment of choice. And of course, if there is a bony metastasis which is causing nerve impingement on the spine or any other site of that sort, we always give radiation for pain relief. But in the end, chemotherapy is the treatment of choice for distant metastasis. Thank you.